Hi, I'm Julie with Wonderfully Made and sitting back here in the comfy chair talking about lymphedema today. Well, actually lymphedema and compression garments and all the things with compression garments. So if I'm looking over to the side, I'm just reviewing some of my notes and the things that I want to discuss and some of the questions that y'all have had on some of the support groups online that we've come across. And if you want to send us a question, please feel free to do that in the comments. I'd be glad to address that or maybe send you a message back or whatever we can do to help you out. I'm with Wonderfully Made Mastectomy Care, Wonderfully Made Intimate Apparel and Mastectomy Care. We have both a retail and a durable medical equipment boutique that is geared for those different things. So let's talk about compression. Let's jump into compression garments. What are compression garments and why do you need to wear them? And a compression garment is simply a garment that's going to have enough support and structure based on the milligrams of mercury per square inch, if I'm not mistaken, is the way that they are done. So it is true medical grade compression. There are a lot of compression socks and compression, all sorts of things that are on the market that are not true medical grade compression. So it really just depends on what you're needing and what condition you have as to what you really should be wearing. So recently in 2024, January 1st, the Lymphedema Treatment Act passed for Medicare to begin covering compression garments for lymphedema. And what is lymphedema? It is a diagnosis that can be primary. It can be secondary due to a condition or traumatic event. It is basically when your lymphatic system has a disruption or a dysfunction for whatever reason, whether that is a significant accident, whether that is a cancer diagnosis, radiation, a surgical procedure that could have damaged your lymphatic system somewhere along the way. And all of a sudden, your body does not handle your lymph fluid the way that it was designed and meant to do. Now, there is hereditary or primary lymphedema. It's really primary lymphedema. And that is when you were essentially born with lymphedema, which is a swelling condition of your lymphatic vessels, a buildup of that lymphatic fluid in that area, that limb, that body part, that you cannot get rid of unless you do some things to combat that. What are the things that combat lymphedema, or what are the treatments for lymphedema? Lymphedema is typically a lifelong condition. It can be managed much like diabetes or anything else that are lifelong conditions. It can be managed to the best of your ability as the person that is experiencing it. And the ways that we manage that are typically with therapies, decongestive therapies through a certified lymphedema therapist. Those are typically either physical therapist or occupational therapist. And sometimes they are massage therapists. They have gone to additional schooling to understand how to massage and how to decongest the lymphatic system. So any set of those people can typically help you. Lymphedema I have found to be one of the most underserved health conditions that I have come across in my lifetime, probably. I have been in the medical world and business not that long. I've always sort of understood what insurance was, how it functioned for us personally as a family. But outside of that, we've not had any significant issues until all of the cancers started happening in our family. And not to get into all that right now. Let's stick with compression. So a compression garment is going to contain the swelling due to lymphedema. It's going to contain and assist your muscles in moving that lymphatic fluid in the normal and natural process that it's supposed to do. There's quite a few other videos out there that explain this far better, probably with diagrams and other things that explain how the lymphatic system works and all of that good stuff. But I'm a durable medical equipment owner, and so what I'm here to do is to fit those people in garments that are effective in containing their lymphedema as part of their treatment regimen. So this is part of their everyday life. You're probably wearing a compression garment. Now, depending on the severity of the lymphedema, depends on what class you fall into and what class of garment that you would need. So there are stages of lymphedema, and there are classes of garments that go along with that stage of lymphedema. Your therapist is typically the one who would determine, based on your therapy, what you need to be in, what class of garment you need to be in, what's going to be best to contain you. You probably know a lot more about your body and the way that things work, and you can describe that to them and figure out what happens. This can cause some significant issues if left undiagnosed and untreated. Weeping of the skin in the lymphatic area, the lymphatic fluid actually just begins to weep out of the skin. You end up with open sores sometimes. Due to lymphedema, the skin can keratinize on the outside, which is almost like a scabbing, a really dry, hard keratinization of the skin where you have had a leakage and that kind of thing. Discoloration just due to the blood flow around this area and the lymphatic leaks, that kind of thing. So what type of garment do you need? Well, that's really up to your therapist. That's between you and the therapist and your physician. We do compression head to toe is what I tell people. And you would not think that you would need compression garments on your toes, but I've seen quite a few patients that we did. And so I also have treated, people that needed compression garments on their heads. My mother-in-law is one of them. Just due to surgery and her head and neck cancer, she wears a nighttime compression garment, and it facilitates in her being able to contain and reduce the swelling that she may experience otherwise. So, do you need a compression bra or a post-surgical bra when having a mastectomy surgery? Let's look at that, because first and foremost, I'm a mastectomy fitter. I deal with a lot of breast cancer patients, and this depends again on your physician. If your physician thinks that it is going to be in your best interest to have a compression garment after surgery to help contain just post-surgical edema, that is just swelling from the surgery and from the trauma in the area, then we can put you in a compression bra for that. That does not necessarily mean that you have post-mastectomy lymphedema yet. If you have ongoing swelling or swelling and pitting and those types of things in the breast tissue that you have remaining or under the arm due to the amount of lymph nodes that were removed in that area in what's called the axilla, then you may need a compression bra longer term or most of the time, or to wear a compression bra at night to contain this lymphatic swelling. And so initially it's going to depend on, do you just need post-surgical or do you need compression? It depends on the surgery you're having, how many lymph nodes they're removing, and what does your physician think overall. And they may not know going in. It may be a week later they decide, let's get her in some compression and let's go that direction with it. So, in those compression bras, there are mastectomy pockets in most of them. If you are having a mastectomy and you need to wear a prosthetic or a post-surgical prosthetic, those do have mastectomy cups sewn into the compression bra already. So I'm going to look at another question. Is it okay to wear with tenderness or potential radiation burn? So if you're going to have radiation on your breast tissue, you need something just very, very soft and very comfortable in that area. That skin is going to go through some changes over the course of the radiation. There are a lot of skincare regimens that are for radiation specifically, And maybe we'll do another video on that at some point with people who know far more about that than I do. But whatever you are comfortable in during your radiation is going to be what you should wear. And typically you probably would not be in compression during that time, but it really just depends on what that looks like. So most of us know that burn patients, though, open wounds, number one, compression helps. Burn patients, as long as you don't have like just the open skin, it's going to typically be wrapped in something. But we also know that compression that has silver intertwined in the garment helps heal some of that in burn patients. So again, I don't want to sound like a broken record, but we're going to refer to the doctors and the people who